Welcome back, dear students. Today we are going to talk about hemostasis. Platelets are key players in hemostasis, the process by which the body seals a ruptured blood vessel and prevents further loss of blood. Although rupture of larger vessels usually requires medical intervention, hemostasis is quite effective in dealing with small, simpler wounds. There are three steps to the process: vascular spasm, the formation of a platelet plug, and coagulation, blood clotting. Vascular spasm. When a vessel is severed or punctured, or when the wall of a vessel is damaged, vascular spasm occurs. In vascular spasm, the smooth muscle in the walls of the vessel contracts dramatically. This smooth muscle has both circular layers. Larger vessels also have longitudinal layers. The circular layers tend to constrict the flow of blood, whereas the longitudinal layers, when present, draw the vessel back into the surrounding tissue, often making it more difficult for a surgeon to locate, clamp, and tie off a severed vessel. The vascular spasm response is believed to be triggered by several chemicals called endothelins that are released by vessel lining cells and by pain receptors in response to vessel injury. This phenomenon typically lasts for up to 30 minutes, although it can last for hours. Formation of the platelet plug. In the second step, platelets, which normally float free in the plasma, encounter the area of vessel rupture with the exposed underlying connective tissue and collagenous fibers. The platelets begin to clump together, become spicked and sticky, and bind to the exposed collagen and endothelial lining. This process is assisted by a glycoprotein in the blood plasma called von Willebrand factor, which helps stabilize the growing platelet plug. As platelets collect, they simultaneously release chemicals from their granules into the plasma that further contribute to hemostasis. A platelet plug can temporarily seal a small opening in a blood vessel. Plug formation, in a sense, buys the body time while more sophisticated and durable repairs are being made. Coagulation. Those more sophisticated and more durable repairs are collectively called coagulation, the formation of a blood clot. The process is sometimes characterized as a cascade because one event prompts the next, as in a multi-level waterfall. The result is the production of a clot made up of a mesh of fibrin and insoluble filamentous protein derived from fibrinogen, the plasma protein introduced earlier in which platelets and blood cells are trapped. Vitamin K, along with biotin and folate, is somewhat unusual among vitamins in that it's not only consumed in the diet but is also synthesized by bacteria residing in the large intestine. The calcium ion, considered factor 4, is derived from the diet and from the breakdown of bone. Some recent evidence indicate that activation of various clotting factors occurs on specific receptor sites on the surfaces of platelets. The 12 clotting factors are numbered 1st through 13 according to the order of their discovery. Why 13? The 12 clotting factors. Factor 6 was once believed to be a distinct clotting factor, but is now thought to be identical to factor 5. Rather than renumber the other factors, factor 6 was allowed to remain as a placeholder and also a reminder that knowledge changes over time. Extrinsic pathway. The quicker responding and more direct extrinsic pathway, also known as the tissue factor pathway, begins when damage occurs to the surrounding tissues, such as in traumatic injury. Upon contact with blood plasma, the damaged extravascular cells, which are extrinsic to the bloodstream, release factor 3, thromboplastin. Sequentially, calcium, then factor 7, proconvertin, which is activated by factor 3, are added, forming an enzyme complex. This enzyme complex leads to activation of factor 10, Stewart-Prower factor, which activates the common pathway discussed below. The events in the extrinsic pathway are completed in a matter of seconds. Intrinsic pathway. The intrinsic pathway, also known as the contact activation pathway, is longer and more complex. In this case, the factors involved are intrinsic to the bloodstream. The pathway can be prompted by damage to the tissues resulting from internal factors such as arterial disease. However, it's most often initiated when factor 12, hegemon factor, comes into contact with foreign materials, such as when a blood sample is put into a glass test tube. Within the body, factor 12 is typically activated when it encounters negatively charged molecules, such as inorganic polymers and phosphate produced earlier in the series of intrinsic pathway reactions. Factor 12 sets off a series of reactions that in turn activates factor 11, antihemolytic factor C or plasma thromboplastin. Then factor 9, antihemolytic factor B or plasma thromboplasmin. In the meantime, chemicals released by the platelets increase the rate of these activation reactions. Finally, factor 8, antihemolytic factor A, from the platelets and endothelial cells combines with factor 9, antihemolytic factor B or plasma thromboplasmin to form an enzyme complex that activates factor 10, Stewart-Prower factor or thrombokinase, leading to the common pathway. The events in the intrinsic pathway are completed in a few minutes. And common pathway. Both the intrinsic and extrinsic pathways lead to the common pathway, in which fibrin is produced to seal off the vessel. Once factor 10 has been activated by either the intrinsic or extrinsic pathway, the enzyme prothrombinase converts factor 2, the inactive enzyme prothrombin, into the active enzyme thrombin. Then thrombin converts factor 1, the soluble fibrinogen, into the insoluble fibrin protein strands. Factor 13 then stabilizes the fibrin clot. Fibrinolysis. The stabilized clot is acted upon by contractile proteins within the platelets. As these proteins contract, they pull on the fibrin threads, binding the edges of the clot more tightly together. This process also wrings out of the clot a small amount of fluid called serum, which is blood plasma without its clotting factors. To restore normal blood flow as the vessel heals, the clot must eventually be removed. Fibrinolysis is the gradual degradation of the clot. Again, there is a fairly complicated series of reactions that involves factor 12 and protein catabolizing enzymes. During this process, the inactive protein plasminogen is converted into the active plasmin, which gradually breaks down the fibrin of the clot. Additionally, bradykinin, a vasodilator, is released, reversing the effects of the serotonin and prostaglandins from the platelets. This allows the smooth muscle in the wall of the vessels to relax and helps to restore the circulation. An anticoagulant is any substance that opposes coagulation. Several circulating plasma anticoagulants play a role in limiting the coagulation process to the region of injury and restoring a normal clot-free condition of blood. For instance, a cluster of proteins collectively referred to as the protein C system inactivates clotting factors involved in the intrinsic pathway. That's it for today, dear students. Good luck. See you later.